Okay, get this. Have you ever heard of a single pill that can treat stomach ulcers, induce labor, manage a miscarriage, and save a new mother from bleeding to death? Today, we're diving into the incredible story of one such pill.
It really sounds like the start of a weird joke, right? I mean, what on earth could possibly connect the lining of your stomach to the process of having a baby?
Well, the answer is a small, pretty unassuming pill called Misoprostol. You can think of it as a medical multi-tool, and its journey from being a niche stomach drug to a global cornerstone of reproductive health is it's fascinating. So what exactly is this stuff? To really understand its power, we've got to break down what it is and, more importantly, what it's mimicking inside our own bodies. Okay, so in your body, you have these things called prostaglandins. Think of them like tiny, superlocal messengers that your body sends out to handle very specific jobs in very specific areas. Misoprostol is just a man-made version of one of those messengers, and because it can talk to different parts of the body, it can do very, very different jobs. The secret to how it can do so much lies in its two primary and totally different actions. It's almost like a key that can magically fit two completely different locks, unlocking two very different doors. On the one hand, it's gastroprotective, fancy word for shielding the stomach. On the other hand, it's uterotonic, meaning it acts directly on the uterus. This dual personality, this is the key to its entire story. So first, let's talk about the stomach. Here, it basically acts like a bodyguard for your stomach lining. It tells the stomach to pump the brakes on acid production, it boosts the protective mucus layer that shields it, and it even increases blood flow to help heal any damage. Pretty clever. Now let's flip over to the uterus, where it has a completely different effect. Here, it causes the cervix to soften and open up, a process we call cervical ripening. And most importantly, it tells the uterine muscles to contract. These two actions right here are the foundation for why it's so widely used today. So how in the world did a drug designed for one thing become a hero in a completely different field of medicine? Well, this is where the story gets really interesting. You know, like a lot of groundbreaking discoveries, misoprostol's journey started with a totally different goal in mind. Its original mission was super specific, and trust me, it had nothing to do with childbirth. So here's its origin story. It was made to stop stomach ulcers in patients, often older folks, who were taking anti-inflammatory drugs like ibuprofen for a long time. It did that job really well, but we don't really use it for that much anymore, mainly because newer drugs came along that do that specific job better. But as its use for stomachs started to fade, doctors began to realize it had this profound effect on the uterus. This side effect would soon become its main purpose, completely rewriting the drug's legacy. And the shift was, well, it was massive. Today, a whopping 85% of misoprostol use is in obstetrics and gynecology. Its original purpose? It's just a tiny slice of the pie now. So what are these critical new uses? Well, it's used for medical abortion, to help safely manage a miscarriage, to induce labor when it's needed, and, this one is huge, to prevent and treat postpartum hemorrhage, which is life-threatening bleeding after childbirth. The fact that it's stable at room temperature makes it an absolute lifesaver in places without reliable refrigeration, getting it into the most remote clinics in the world. Because it does so many different things, how you take it is really tailored to the specific job it needs to do. And that, of course, also affects what a patient should expect to feel. Now, this is actually pretty cool. For stomach protection, you just swallow it. Simple. But for all the obstetric uses, it can be dissolved in the cheek, put under the tongue for really fast absorption, or even used vaginally for a longer, more targeted effect. As you'd probably guess with a drug this powerful, there are side effects. Things like cramping, diarrhea, fever, that's all really common. But here's the key thing. In its obstetric uses, the bleeding and cramping aren't just side effects. They are the intended effect. That's the medicine doing exactly what it's supposed to do. So the crucial thing is knowing the difference between what's expected and what's a serious red flag. We're talking about very heavy bleeding, like soaking more than 2 big pads an hour, or signs of infection. Those things mean you need to get medical help right away. It's vital to know those warning signs. And because misoprostol is so potent, using it safely is absolutely non-negotiable. You have to respect its power, and that means following some very strict guidelines. This quote really says it all. The drug's power demands respect. The message couldn't be clearer. It has to be used with proper medical guidance. This is not a medication you guess with.
So here are the three absolute non-negotiables. First, it absolutely cannot be used for stomach ulcers if you're pregnant. It can end the pregnancy or cause birth defects. Second, when it's used to induce labor, it must be done in a hospital because of that rare but serious risk of uterine rupture. And third, pretty simple, don't use it if you're allergic to prostaglandins. So when you put this all together, what's the legacy of this simple, powerful pill? It's really a story of accidental discovery and just profound medical impact. From its humble beginnings as a stomach protector, misoprostol has become one of the most essential medications in the entire world, especially for reproductive health. It's effective, it's stable, and it saves lives every single day. The story of misoprostol really proves that a drug's purpose can evolve far beyond what anyone ever designed it for. And it leaves us with a really critical question for the future of medicine. When a tool proves to be way more powerful and versatile than anyone imagined, who gets to decide how it's used?